Hello and welcome to ChristLove Home Care. On this video, we are going to talk about the competency in various areas by going through some questions. There is a competency exam that you'll be required to complete annually, and you need a score of 40 out of 50 in order to pass. So we'll go ahead and just go through some of these questions and to cover the various competency topics that are required for you to know as a supportive care worker. So let's start with question number 1. Which of the following activities is a care aide permitted to perform? Number A, take telephone orders from a doctor. B, assist a client with transferring, repositioning, and walking. C, give medications. And D, perform procedures that require sterile techniques. So as you can see, the answer to this question, let's go ahead and talk about one by one. Choice number A, take telephone orders from a doctor. That's not a job of a supportive care worker. All can take telephone orders from a doctor. Give medications. As a supportive care worker, we all remind clients to take their medications. We remind them. You can't just give medications. There is a protocol. Medications have to be pre-popped by a nurse, because you, as a supportive care worker, you cannot determine the dosage, how many pills they're supposed to get. That's just the work of a nurse. So within your job description, we talk about you can assist with medications, yes, like whatever that has been already pre-selected by a nurse or by their pharmacy. It's pre-selected. You're not selecting or choosing the number of pills to give a patient or to give your client that you work for. You can assist them by opening the packets, putting it in their hands, and helping them take them and swallow them. So another one is perform procedures that require sterile techniques. So as a supportive care worker, you do not do any sterile procedures. Again, that's the work of a nurse. So that leaves us with choice number B, assist client with transferring, repositioning, and walking. So that's the answer for question number 1, and that's part of your job description, assisting a client in walking, repositioning, and transferring. Question number 2, when documenting information in a client's file, which of the following is correct? A, chart procedures before they are completed. That's just very wrong. You cannot chart procedures before. You chart procedures after they are completed and not before. Use an eraser for correction to keep notations neat. As a matter of fact, if you're documenting, some of you caregivers, you have notes in your various locations, and if you mistakenly documented something that is not correct, you are just supposed to cross with a line, one line, and then put your initial there, and then you can now write whatever that is correct. But you can't just use an eraser. We don't do that. Document an observation that a team member saw. You only document what you saw, not what another person saw. So that leaves us with choice number B, cross out incorrect information and initial the correction. And that's the answer for the question number 2. Number 3, a client's risk of injury can be reduced by, the risk of injury can be reduced by decreased vision. No, that's actually the opposite. Use of medication. No, actually medication may help decrease awareness. No, that's just the opposite. But wearing anti-slip footwear will help reduce risk of injury. So if your client is is ambulatory, can walk, you want to have them wear the anti-slip footwear. Another point I'll put here, make sure there are no rugs or something that can make them fall. Number 4, when applying a transfer belt onto a client, a care aid should. So when you talk about choice number A, have the client stand up first, well, you have a transfer belt, you have to put it on first before they can stand up. You actually put it when they are seated, not when they are standing up. Place the belt around the client's chest. Well, that's just not the appropriate way to do it. Ensure the belt is tight, even if it makes breathing difficult. No, actually, you have to make sure that the belt is not too tight. The client can breathe even while having the belt on it. You make sure there are at least 2 finger spaces underneath the belt. So that leaves us with 12. Now we apply the belt directly over the client's clothing. Number 5, which of the following is considered a healthy type of grief for dying client to experience? So we have complicated grief from the word, that's not a healthy type of grief. Unresolved grief from the word, that's not a healthy type of grief. Inhibited grief, no. So the type of grief for a dying client, the healthy one, is anticipatory grief. Choice number B. Number 6, a client asks to read a care aid notes after she has written them. What should a care aid do? You are supposed to allow the client to read the notes. They have a right to access any information you're documenting on them. So just allow them to read the notes. Number 7, which would a care aid not do when trying to get a senior to eat properly? Serving snacks between meals, that is appropriate. Flavoring the food with herbs and spices, yes, that will get them to get to eat. Serve food which the senior enjoys, that's right. And so you have to note the question said not do. So these are things that we should do. The only thing that you should not do is serve 3 large meals a day. Question number 8. Which of the following is a safe way to handle food? Throw food in the refrigerator. That's right. So these other choices, when we look at it, they are not correct. Just make sure you throw food in the refrigerator. Leaving cooked food out of refrigerator overnight, that will just spoil the food. Use the same cutting board for meat and vegetable. No, you have to wash before cutting your meat or your vegetables. Ensure meat is cooked enough by smelling it. No, you don't know that meat is cooked enough by smelling it, so that's just not right. That leaves us with choice number A. Number 9, which of the following does not cause urinary incontinence? So UTI, known by urinary tract infection, can cause urinary incontinence, and you want to, based on your job description, if you notice that the client is not voiding, like producing urine, as the normal way of producing urine, either they have a catheter and you have not drained your catheter, the required amount is at least 30 ml per hour or 248 hours. So if you realize there's reduced urinary output, you may want to contact your supervisor or your nurse for clients who have nurse supervision, or clients that do not have nurse supervision under ChristLove Home Care. Yeah, you can still let the supervisor know, the administrator know, and they can refer the client to be seen by their primary care provider. Also, if you notice they are not their normal mood, they may be agitated a little bit, some of the signs of UTI infection. If you notice there's something odd with their temperature, you know, um, but mainly their urinary output, they are not peeing as much. Um, just make sure you're either telling your supervisor or referring the client to um, tell your supervisor to call the client to see if they can be seen by a doctor. There are certain medications that can actually cause urinary incontinence and some conditions of the nervous system, but underwear that is too tight, that is not a cause for urinary incontinence. Constipation can be caused by you want to encourage clients to eat as much fiber in their diet to promote uh, elimination of feces. By them eating little fiber in the diet, that's just a way of they are more likely to be constipated. Drinking much water is good. You want them to drink water. You want them to It's good, but it is not, you cannot say that is the cause of constipation. So what you're looking for, constipation, fiber is what promotes bowel elimination. When you take more fiber, roughages, leafy greens, those kind of healthy meals like that have fiber, you'll be able to prevent constipation. And when you take little fiber in your diet, then you're more likely to have constipation. So you want to advise your clients, not advise, but recommend that they at least eat some food rich in fiber. What does a care aide not usually document after observing a stool specimen? Well, based on job description, you're just supposed to know the how the feces looked like, how the stool looks like. Is there any blood in the stool? That one you have to report to your supervisor. You have to check the amount of bowel movement. Was it large or small? Was it medium or was it just a smear? You have to note. And if the client has not had a bowel movement for 3 consecutive days, you want to contact the nurse. You want to contact your supervisor and let them know they have not had a bowel movement for 3 days, and they will advise you what to do. These are for clients that have nurse supervision under ChristLove. Those who do not have nurse supervision under ChristLove, just let your supervisor know, write that in your report. We'll reach out to them. They will be able to seek assistance from their care provider. But this is something that you need to watch over. They need to be able to have a bowel movement at least within 3 days. So you'll be able to know the amount of the bowel movement, the color of the feces. That way you can know, is it a bloody feces? If it's bloody, you have to record what you see. Consistency and shape of the feces, yes, you have to say, is it well formed? Was it watery? You have to check on that. But temperature of the feces, that's not something that we even need to know as based on your job description. So we don't really document the temperature. That's really not information that is needed. Immobility can cause a number of problems for a client. Which of the following is an emotional consequence of immobility? Depression. That's right. Depression is an emotional, you can see emotional consequence of immobility. I'm just going to focus on what you guys really need to know. Some other terms, they are really not within your job description. But everybody knows dementia. It's a cognitive disease, especially elderly. Loss of memory, knowing how to do things. But we'll just leave it at that. The emotional consequence of immobility, depression. So, just for education purposes, I may go over the the other terms and definitions. So, delirium is simply a serious change in mental abilities. It results in confused thinking and a lack of awareness of someone's surrounding. The disorder usually comes on fast within hours or a few days, and it can be traced to one or more factors. All right, let's go to number 13. When caring for a client with indwelling catheters, a care aid does not. So always remember when you're answering any questions, look at does not. It's not always a wrong answer. Sometimes they are, you have to make sure you're selecting the correct answer based on what the question has asked. When caring for clients with indwelling catheters, a care aid does not. This is something that you do not do. So, what are the things that you are supposed to do when you are caring for clients with indwelling catheters? And is draining freely into the drainage bag? Yes, you have to observe that. Tape catheter through the inside of the thigh. Yes, that's what you do. And caregivers that are dealing with clients that have a catheter on, that have nurse supervision on, this is not new to you. Document the color and amount of urine in collection bag. It's very important to check the color of the urine, to check the amount that is being collected in the bag. If you notice, like I said previously, if there is less output within a 1 hour, there's less than 30 ml, or within 8 hours, the client has voided less than 240 that is required minimal within an 8 hour shift, then you have to report. If the urine is bloody or it's milky, you have to report that. Those are the things that you check even when you're documenting on your shift report forms for those who have files in your locations. Clean the catheter and give pericare weekly. You do not do that. You don't do that. Number 14, when assisting a client with his medication, the care aid does not. I talked about this earlier. The choice number B, count out the required number of tablets and give them to the client. Your job is not to count and determine the dosage. We don't do that. As a supportive care worker, you're not supposed to do that. But loosen and remove container lids, yes, that you do that. Watch the client when he pours medication into the spoon, hand, or cup. That's your job to do that. Bring pre-filled syringes to clients according to the care plan. Yes, remember the word pre-filled. You're not selecting the dosage. You're not selecting the amount that is required to take. It has been pre-selected. You're just giving that to the client. So that's allowed. But you cannot count. Counting means you're determining the dosage, and you cannot do that. Only the nurse can determine the dosage. An example of a blood-borne disease is hepatitis B. So most of you guys in your higher forms, you opted not to receive the hepatitis B vaccine. But if you're working with clients, especially skilled care clients or any type of client, it's good to have the vaccine, but you can opt out. So hepatitis B is a blood-borne disease. A care aid is with the client who starts to fall, the care aid should. So we say never catch a fall. Just ease the person gently to the floor as the care aid bends her knees and straightens back. Never try to catch a fall. Try to stop the fall by grabbing hold of his arms. You don't do that. Allow him to fall and hopefully land safely. You don't do that. Lower him slowly to the floor as the care aid leans over from the waist. No, no, no. You don't do that. You have to ease him gently to the floor, allow him to fall, ease him gently to the floor as the care aid bends her knees and straightens back. A care aid is caring for a bedridden client who needs to be turned often. Since she is working alone, the care aid should lower bed rails on both sides of the bed. Remember, the question says what you should not. And remember, the question is saying this care aid is working alone. So by laying bed rails on both sides of the bed, that's actually dangerous because they will fall. They may fall. So adjust the height of the bed to avoid reaching, twisting, or bending. You should do that. A full turning sheet is under the client. Always, always very important. For those people that I supervise directly, you know that that turning sheet has to be there. It has to be there. You cannot hold the client's body. You have to use that turning sheet underneath. Move him in several small movements instead of one motion. No, actually, I do one big movement, not several small movements. Okay. So, sorry, I apologize. Move him in several small movements instead of one motion. Actually, true. That is true, because you several small movements instead of one big motion because you are working alone. That's the catch of the question there. You're working alone. If you guys were two people and you need to lift the person up in bed, one holds the other side, the bed sheet with handles, holds the other side, the other one on the other side, and then you count one. You notify the client that you'll be moving them up in the bed, and then you count 1, 2, and 3, and then you say at the count of 3, we are going to move you up in the bed. And most of the time, I tell caregivers ensure at least there's a pillow on the head of the bed, so that in case you're doing that move, he does not hit the head of the bed on the bed board. So you can do one big motion if you're two. But if you're alone, you want to do small movements until the client gets where they need to, you want them placed in the bed. When you offer a client with an injured arm, a care aid should put clothing on the injured arm first. You always start the bad arm first, and then the good arm later. To be an active and effective team member, a care aid would not. Remember, would not. You want to be an effective team member. For those people that have back-to-back shifts, talk about 24-hour shifts, you probably be working with some team members. You're working with a nurse, or you're working, both of you, doing showers and all that. So as an effective team member, you want to try to solve problems. You want to provide input and offer opinions. You want to consult with other team players so that you guys can work effectively. But being unwilling to compromise, that is not being active and effective team members. There are various ways. Sometimes life stuff happens. Maybe a caregiver needs to get off for something very important. They can talk to you and say, I can work for you on this day, and are you able to be willing to work for me on this day? That way I can be able to go on this appointment, or I can be able to do this. Or you guys can decide to maybe there are various tasks that need to be done. You can talk among yourselves and see and reach an agreement. And you can also involve the supervisor. So being unwilling to compromise is not an active and effective way team members a care aid. When handling household waste, which of the following is not correct? Not correct. What is not correct? What is correct? Correct is wash hands for 15 seconds with soap and water after contact with waste. Hand washing is very important. If you have not been checked off on hand washing, your supervisor will be reaching out so that we can have that done. They will ask whether you'll be shown how you're supposed to do hand washing, and then you will be told how you can do it. For some people that are verified, or supervisors that are verified, they may ask you to send a video on how you properly wash hands according to the criteria and being checked out on that one. Sort all into correct categories at the spot where they are produced. Sort all waste into correct categories at the spot where they are produced. That's correct. Keep waste in separate packaging during collection, storage, and transportation. That's correct. But you see here when they're saying handling household waste, place soiled baggages, disposal sheets, and disposal gloves directly into waste containers. No, you don't do that. You have to put it in a bag fast. Which of the following confidentiality practices is not okay? The client's personal information will be shared with another agency care aid who is not involved with his care. Definitely that is wrong. You only share information for people who are within working directly with that client within the same agency and not another agency. The rest, you have to, they said the client's personal information may be shared with others as long as the client's consent. Remember, the client has to consent. The personal information of clients should be kept secure and private. That is correct. The client's personal information should only be used for purposes in which it is intended. And that's correct. When dating a client, which of the following activities would a care aid not do? Work from the dirtiest areas to the cleanest areas. So you don't do that. You have to wash the clean areas first, and then most of the time we finish with private care, the private part. You wash all the other places and then you finish with the private part. So you always need to provide privacy. Make sure the water is at a comfortable temperature. When testing the temperature of the waters, I have where the aids that I've directly supervised. You're supposed to test with at the back of your hand, not with a glove on. Not with a glove on. Because the glove, it may be hot, but the glove, you may think is the right temperature. So you need, when testing the temperature of water, you have to test it with your bare hands, not with the gloves on. And always communicate with the client and ask them if that's the right temperature. Or for nonverbal clients, just you can use nonverbal cues. Make sure the temperature is not hot to burn your client. It's lukewarm or warm. Work from the cleanest areas to the dirtiest areas. That's correct. Use soap fast followed by a thorough rinsing. And that's correct. Number 23, a client is reacting to his illness by turning away from others. A care aid can help him through with this withdrawal reaction by scheduling family activities along with care and rest period. That's what you do for that. Number 24, what is the most effective way to prevent a client's skin from breaking down? And the cubitus ulcers from forming. So you have to, we say you have to reposition every 2 hours. Other things that will make sure that's what you can do. Other things, just let your supervisor know what kind of mattress does the client have. A pressure sore mattress really helps to prevent sores, but you as a caregiver, you have to reposition every 2 hours. And for those, when you're alone, you have been taught, for those who handle clients with Hoyas, you can actually reposition them with the Hoya while they're still in bed. But you cannot do a transfer alone. It has to be two people all the time. Two people transfers. But we reposition every 2 hours. A client's care plan states he is to do his range of motion exercises. PID stands for 3 times a day. At what times during the day should these exercises be scheduled? So you just look for a choice that has 3 times a day, and the only one that's D. The rest has 4 times a day, that's QID. Plus B, that's BID. BID stands for twice a day. QID is 4 times a day. PID is 3 times a day. That gives us choice number D. A number of methods can be used to determine if a nonverbal client is experiencing pain or discomfort. Which of the following behaviors does not suggest pain? Constant coughing does not suggest pain. When you see a client holding an affected part of the body, you may ask, are you in pain? That's it's an nonverbal client. So you may see this person is holding a certain area all the time. That may be a cue that they're experiencing pain or discomfort. Maybe they're refusing to move. Yeah, maybe when they move, they exhibit some form of pain. Restlessness, irritability, and mourning, those are nonverbal cues of experiencing pain. But constant coughing, no. 27. A care aide finds her frail client wedged between the wall and his will, lest be he is unresponsive. What should the care aide do? Of course, call 911, call for assistance. Call 911. I will tell you that you find a client is unresponsive, just call 911 and stay with the client. A client comes from a culture that believes bathing should be done weekly. This person is incontinent of both stool and urine and should be bathed daily. How should a care aide handle this situation? So they don't want to take a shower. They have a right to do what they want to do. It's our job to make sure also that they are clean. So you can suggest, hey, how about I just wash the dirty areas as needed between the regular weekly bath? So sometimes you just get creative with the client, suggest just washing the dirty areas. That way they're still clean and then they can get their weekly bath. Which of the following will the care aide not do to prevent transmitting germs? Not do, remember, you cannot wash gloves. You cannot reuse gloves. You never reuse gloves. Once you use the gloves, you have to throw them. You cannot reuse the gloves. You have to wear masks, eye protection, or face shield during procedures that are likely to cause a splash. My caregivers, those that are helping skilled clients, you know that whenever you're doing maybe oral care for clients that are, they can't do anything, they're total cares, I emphasize wearing of the mask, eye protection when doing cleaning their mouth. What else between tasks and procedures on the same client? This, you do that. You will notice that a nurse or a caregiver is doing hand hygiene in between tasks. Once they are done with one task, they do hand hygiene, they change gloves, they take another one. So some clients may say, oh, you're using too much gloves. They need to know that it is important in order to prevent transmission of infection. And whenever you have issues with the gloves at your workplace, please let the supervisor know. They'll be able to talk to the client, because we've had instances of clients like they're using too many gloves. They're just supposed to use one glove for everything. No, no. If the client, maybe they talk like that, they have problem getting resources for gloves, then you need to reach out to the office, to your supervisor, and let them know the challenges you're having. Because what I say, if you cannot do it correctly, don't do it at all. You have to do it correctly. You cannot be reusing gloves. You cannot be managing gloves. Yes, you manage the gloves, but you have to ensure that you are working out for infection control. So those issues, we'll be able to deal with those. So please feel free to reach out to the office and let us know if you have any challenges at your specific locations. A care aide is assisting a client to prepare for an appointment. He insists on wearing his favorite shirt, which is stained and frayed. What should the care aide do? So remember, the client they have a right, and you cannot tell them they cannot wear it. You can inform this. Okay, you can just inform your supervisor. Yes, however, they have a right to wear what they want to wear. And you cannot choose the shirt for them. They have already chosen the shirt that they want to wear. So let them wear the shirt. Which of the following is not an effective listening technique? Being unsympathetic and judgmental. That's just, it stands out there. You have to be able to understand gestures, words, and behavior. You have to be a good listener. You have to recognize when to stop listening and when to start providing suitable replies. Question number 32. A client hands his care aide $25 for all the little extras she does for him. What should the care aide do? You have to thank him for the thought, but don't accept the money. Do not accept the money. And just make sure you are letting the office know as well, so that we can talk to the client and let them know that a care aide cannot accept money from the client. And also, a care aide cannot give money to the client. No matter the need that you see, maybe you see a client that is in need of something, you cannot give them money. Talk to your supervisor, let the agency know, and they'll be able to look for resources for them to get their needs met. But it is unprofessional to think that you can be buying things for the client. So it's vice versa. You cannot buy anything for them, because sometimes we've had reports, caregivers say, oh, this client asked me to buy this for them and this for them. You cannot do that. And you cannot receive anything that they give you. Which of the following will help prevent germs from spreading? Going to work with an undiagnosed rash. So, which of the following will help prevent germs from spreading? Just a minute as we take a break. I need to review these answers right now. Welcome back to the second session. we head to break, and so that I can review question number 33. And I would like to correct the answer there. Which of the following will help prevent germs from spreading? So the correct answer for this will be washing hands thoroughly at the beginning and end of shift. Okay, so yeah, that is not the correct answer, because you don't wash hands only at the beginning and end of shift. You wash your hands every time you are doing a task, before you do a task and after you do a task. You wash your hands before you put on your gloves. You wash your hands after you're done. You don the gloves. You remove the gloves. Don is putting on, doff is putting off. So you wash your hands before you put on your gloves, and once you remove your gloves, you also wash your hands. So that is why choice number C is wrong. C is wrong. Washing hands thoroughly at the beginning and end of shift. So that is wrong. Rubbing eyes with hands, that is not going to help prevent germs from spreading. Will help prevent germs from spreading. Keeping immunizations up to date, well, that has not really directly correlated to germs. So we have eliminated 3 answers that are really not correct. Going to work with an undiagnosed rash. It's undiagnosed. So that's the only answer that we have left there. I had to think a minute for question number 33 before we could continue. So we have eliminated D, C, and B. That leaves us with A. Though I don't like how they wrote that question, but that leaves us with that answer there. If we are doing a marking and evaluation, this is one of the questions. We'll give it as a free points because of the way it has been structured. Let's move on. Question number 34. A care aide observes a co-worker sneaking a drink of alcohol while on duty. As a care aide, what should her first step be? So the first step is you have to follow your company's policy for reporting suspected alcohol abuse. That's what you need to do. Follow company's policy for reporting suspected alcohol abuse. So looking at the other choices, let other employees know that she saw her consume alcohol. You don't want to do that. Advise the coworker that she saw her drink a drink. You don't want to get into confrontation, so you don't want to do that. Notify the supervisor, though it looks the correct answer. However, when it comes to alcohol, you have to follow your company's policy for reporting suspected alcohol abuse. Refer to the policy first. Next thing, and then it will tell you what to do thereafter. So all we know that you're not supposed to drink at work. You're not supposed to smoke at work. Especially we have some of our clients have oxygen, so you can't be smoking. And there's this funny situation that, like, the client is a smoker, I'm a smoker, so when they smoke theirs, I smoke mine. You cannot do that. I had one caregiver tell me that you can't do that. You have to remain professional at all times at your various locations. An individual hired as a companion is not permitted to: number one, converse and play games with the client as part of companionship. Help client to keep in touch with friends and outside the world. That's part of companion care. Transport client to appointment, run errands, and shop. Yeah, that's part of companion care. However, our agency, we do not allow caregivers to transport clients. They can only escort clients to appointments, errands, and shop, wherever they need to go. They provide the means of transportation. You escort them anywhere that they need to go. So, assist client with range of motion exercises. That's a skilled type of care. Only a nurse or a trained or physical therapist or trained workers can do that, but not you have been hired to do companion care. You cannot assist with any exercises because you're not a therapist. That's skilled care. So you don't do that. Which of the following is not one of the vital signs? So we have blood pressure, temperature, pulse. Those are vital signs. Radiating down left arm, that is not a vital sign. We have other vital signs like oxygen. And you have to, for you caregivers that have clients on oxygen, you have to be monitoring that oxygen and you have to be recording that oxygen. Especially 24-hour care clients on oxygen, you have to monitor those. You normally have supervision round the clock on that. Just make sure you're reporting any oxygen levels that are not normal for that specific client, and your nurse or your supervisor communicates what is normal and what's not. So it's your job to monitor some of these vital signs. For example, if the blood pressure is too high, you can know what is the normal range and what is high, what is low, and notify your supervisor on that. Temperature, pulse, and the current equipments that we have, they're really good. That like the blood pressure, you don't have to do it manually anymore. We have the updated blood pressure machines, and the pulse, oxygen, and temperature. That's easy for any supportive care worker to take vitals. So number 37, I will also talk about the vital signs there. Whenever you realize that the oxygen levels of a client is low, you want to notify your supervisor and call 911. You always want to notify your supervisor and then call 911. Or for some caregivers with clients, you call your who have 24-hour skilled care with a nurse supervisor. They can call their nurse and the nurse will tell them what to do, and the nurse will determine whether the client goes to hospital or not. However, in an emergency situation, it doesn't hurt to call 911. Which of the following methods would a care aide not use to share information about a client's status with other members of the healthcare team? You cannot text a client's status. You can use progress notes, shift change reports, follow-up reports. Those remain within the location where you're working, but texting, you cannot text about a client status because that is a violation of you may violate their privacy in that manner. So texting is not. A client asks his care aide for the name and phone number of the supervisor so he can complain about another care aide. What should the care aide do? Give him the supervisor's name and phone number. It's their right to have that. The basics of good housekeeping do not include overlooking greasy or wet surfaces. The basics of good housekeeping. So keeping work areas neat and orderly, those are the basics. Maintaining halls and floors free of slip and trip hazards. We don't want to have rags or things that clients can slip and fall. Removing waste materials, those are good basics of good housekeeping. So that leaves us with number A, overlooking greasy or wet surfaces. A client starts vomiting while lying in bed. Which of the following would a care aide not do? When you see them vomiting, you cannot lay them back in a flat position because they are vomiting. When you do that, they can choke. So these are the options. Turn his head and body over to the side. Good. That's what you need to do to help the vomit be able to find its way out. Place a kidney basin under his chin here so that he can vomit. Help him rinse his mouth with water. Those are good choices. So the question was asking not do, so we have that A as the best answer. No, A as the wrong answer. That is the wrong answer. You can never have the client lie flat. Even with other clients, you make sure the head of the bed is a little bit raised. Which of the following signs or symptoms should a care aide be alert for if a client is wearing an anti-embolism stocking on one leg? They should be alert for lack of feeling or tingling in the leg wearing the socks. So if the client says they're not feeling or there's tingling in the leg, you have to report that to your supervisor. Which of the following would a care aide not do when dealing with a difficult client? Let him know he is the one with the problem. You don't want to get in a confrontation and tell the client you're the one with the problem. No. So that is what you are not going to do when dealing with a difficult client, because that will just create an argument and then things go south. So you always want to be professional at all time. You can find out why he's having a problem. You can show an interest in him that we are care aides. So you're interested in his care and his well-being. Change whatever she can with herself. Yes. But you don't get into a confrontation with a client. Aphasia often develops after a stroke or brain injury. What would a care aide not do when trying to communicate with a client who has aphasia? So you want to stop trying to figure him out and go on to something else. So it's saying not do. So let's look at the other choices. We have use body language to interpret what he's trying to say because he's having difficulty with speech. His ability to communicate has been impaired, so you want to use body language, what he's trying to say. Advise him that she don't understand what he is trying to say. Yes. You really want to get the most communication out of the client. Non-verbal cues, you want to note that. You want to be patient and give enough time and try to communicate. But choice number D, you want to stop trying to figure him out and go on to something else. That is, you don't want to neglect their needs just because they have communication difficulties. You really want to try and help him out and find out what he is trying to communicate and get his needs taken care of. A client is very committed to his religion, likes to discuss his beliefs with his care aides. The care aides does not share his beliefs. How should a care aide help him? Just let the client talk about his beliefs. That's their home. This is their service. Let them talk about their beliefs. Don't impose your beliefs on them. Let them talk about their beliefs. Let him talk, then tell him what her religious beliefs are. No, you don't want to do that. Ask him to change the subject from religion. No, they want to talk about that. Let them talk about it. Tell him she won't come again if he talks about religion. Those are not good choices, so we have choice number A as our best answer. Rehabilitation begins with the prevention of contractures and pressure sores. I think we talked about pressure sores, and then some question up there. They are repositioning every 2 hours for clients who cannot reposition themselves. They're not ambulatory. Number 46, when communicating with seniors who have dementia, a care aide should not ask more than one question at a time. Yes, it's very important to know how to communicate with clients with dementia because you don't want to overwhelm them. You want to ask one question at a time because even for example, like you don't want to overwhelm them. One question at a time. Speak to them in a normal tone and volume of voice. Yes, you don't want to shout, high pitch. No. Keep eye contact and smile. Avoid frowning. Talk while she walks with those who pace back and forth. So, what the care aide should not do is ask more than one question at a time. That's just not the correct answer. Because you all know about dementia, it's memory loss. So you don't want to overwhelm them. Question number 47. A doctor phones to report he has ordered a new medication for a client. He states it must be administered as soon as the pharmacy delivers it. The care aide is the only person with the client. There is no family locally. The client is unable to give the medication to himself. What should a care aide do? Contact your supervisor. So we said as a supportive care worker, you cannot determine the dosage of the medicine that the client needs to take. You cannot take orders directly from a doctor. You cannot decide this is what he's taking or not. Is the nurse or pre-filled packets with the date, the day, and the time. You're just assisting them get that medication, but you're not determining the dosage. You're not determining the time they should take. Everything is outlined there. So in this situation, you have to contact your supervisor. A person who has an infection may exhibit one or more of a combination of symptoms. Which of the following symptoms does not suggest an infection is present? Low temperature, no. We High temperature is a suggestion that there is some infection going on, but not low temperature. Redness and inflammation, yes, there's some infection there. A discharge and fever, infection, nausea and vomiting, infection, signs. That's why whenever you see any of these on a client, you really want to notify your supervisor and document. A client is temporarily paralyzed from waist down. A carer should provide support with his daily activities of daily living by encouraging him to do as much as his self-care as possible. Yeah, you want to see how well he can do what he can. He's just paralyzed from waist downwards, which means he can do some things with his upper arms. And because if you don't encourage the client to try and do these things, they will not be able to, they will get used and they'll not be able to um, get things done without assistance, of which they are able to do it on their own. You only come in to help what they cannot do, because you want to encourage that independence. But whatever that they cannot do, you have to assist. Which of the following statements about use sharp objects is not correct? Whenever you're doing any exam, just make sure you are answering the question. It's not all the time that they're asking for the correct answer. Sometimes the wrong answer is the right answer. They are just asking you to eliminate and choose the wrong answer, which is the answer. So he's saying not correct. Let's start with what is correct about sharp object. Sharp objects should be recapped, bent, sheathed, or broken. Sharp object should not, sorry, I read that wrong. I was like, no, you cannot recap a sharp object. Guys, you cannot. You cannot recap a sharp object. You cannot bend it. You cannot shear or break it. So sharp objects should be discarded in puncture-proof containers. That's what we do. Sharp objects should be picked up by mechanical means. That's true. But sharp objects should be uncapped when they are carried. No, they have to be capped. So that brings us to the end of a review of our competency questions. You want to go through this video before taking the competency test exam that has been sent to you guys' emails. On the space where you have to put an entry, you just type the letter that is the answer to the question. When you see number 1, there is a text box that is next to the question. So you read the question and then you answer. You select the answer that is correct. If it's A, you just type A on that text box. If it's B, you just type B, and so forth and so on. So the competency test is not timed. It's at your own pace. This is the test will be doing this annually. So you want to review and understand these topics. If there's any question, you can always reach out and ask. And finally, after the completion of this test, we are going to check you guys off on some practical aspects, such as the first one we'll start with is hand washing. And the supervisor will be able to communicate how we will be able to get that checked off from everybody. That's very important. Hand washing, that's the first thing that breaks the cycle of infection, spread of germs, spread of diseases, proper washing of hands. And we want to make sure that everybody knows the correct way of how they need to wash their hands. So we may be sending another video on hand washing, and also have you guys demonstrate on how you wash your hands properly. Thank you very much. I wish you guys best of luck in your competency tests.